Greetings to everyone. I present to you the correction of these internal medicine questions sent to you by Excellence Academy. The reference bilingual group by Excellence specialized in mentorship, orientation, and preparation of the residency concours in Cameroon and abroad. The instructions. Each question or statement below is followed by several propositions. Select the statement that best answers the question or best completes the statement. Question 1. A 20-year-old woman presents with a history of pollakiuria that has been evolving for 2 days. She states that she recently got married and was not sexually active before marriage. Physical examination revealed a temperature of 38.2 degrees Celsius with normal vital signs. The gynecological examination does not reveal any discharge, vaginitis, or cervicitis. Urinalysis reveals 4 white blood cells per field under high magnification with many gram-negative rods. Which of the following drugs is the most appropriate treatment? A. Ceftriaxone, B. Fluconazole, C. Gentamicin, D. Metronidazole, E. Trimethoprim sulfamethoxazole. So here from the clinical presentation, we can diagnose that the patient presents with acute uncomplicated cystitis, likely a honeymoon cystitis. So the urinalysis shows pyuria, 14 white blood cells per field, and gram-negative rods, strongly suggesting E. coli, which is the most common uropathogen. Ceftriaxone is typically used for more severe infections like pyelonephritis or uncomplicated urinary tract infections, so it is not appropriate here. Fluconazole is used instead for fungal infections like candidiasis and not relevant here. Gentamicin is used for complicated or severe UTIs, usually in a hospital setting. It is too strong for simple cystitis, not appropriate here. Metronidazole is used for anaerobic infections and Trichomonas vaginalis, vaginitis, so it is not appropriate here. Trimethoprim sulfamethoxazole is the first-line treatment for uncomplicated cystitis, provided local resistance to Escherichia coli is not greater than 20%. So we have to know that if local resistance to E. coli is greater than 20%, the alternatives that we can use is you have nitrofurantoin and an oral cephalosporin, but not ceftriaxone, which is injectable. So the correct answer here is E. Question 2. A 67-year-old man presents to the emergency room with shaky chills and a temperature of 38.0 degrees Celsius. Laboratory examination reveals a hematocrit of 23%. We can already highlight there that is a severe anemia, and urine tests are positive for blood. The patient states that he takes only one medication for his infection. Which of the following medications was most likely to cause the occurrence of these signs and symptoms in this patient? A. Cephalexin, B. Gentamicin, C. Linezolid, D. Metronidazole, E. Mupirocin. So here we have to understand that the most likely medication responsible for the symptoms presented here is linezolid. And there are 4 reasons here in favor of this. The first, the presence of the severe anemia, marked here by hematocrit at 23%. So linezolid is known to cause bone marrow suppression, leading to anemia, thrombocytopenia, and leukopenia. Prolonged use of linezolid is particularly associated with aplastic anemia or hemolytic anemia. The second reason here is the presence of fever and shaky chills. This may indicate a drug-induced reaction or an opportunistic infection due to immunosuppression from the anemia or the leukopenia. Another reason here in favor of this medication as cause is the presence of hematuria, positive urine test for blood. So we need to know that if the anemia is due to hemolysis, then free hemoglobin can be filtered by the kidneys, leading to hemoglobinuria, which appears as blood in the urine. And also the taking of a single medication for an infection equally make us to point at linezolid, because it is used to treat serious bacterial infections including methicillin-resistant Staphylococcus aureus and vancomycin-resistant Enterococcus infections. So cephalexin is not retained here because it can cause hemolytic anemia. That is possible, but it is rare and usually not associated with significant marrow suppression, as is the case here. So it will not cause the severe anemia as we are seeing here, but it can cause hemolytic anemia, but not severe up to 23%. Gentamicin is more likely to cause nephrotoxicity and ototoxicity, but not severe anemia. Metronidazole can cause neuropathy and GI, that is gastrointestinal side effects, but does not typically cause anemia or hematuria. Mupirocin is not correct because it's a topical antibiotic that does not cause systemic effects like anemia. So we can conclude that linezolid is the most probable cause due to its well-known adverse effect of bone marrow suppression, leading to severe anemia and hemolysis. Question number 3. A 70-year-old male complains of epigastric pain. It is difficult for him to lean forward and he sleeps on a wedge-shaped pillow to try to reduce the burning sensation. Which of the following agents would be most effective in reducing the symptoms, in reducing his symptoms? A. Bisacodyl, B. Cimetidine, C. Magnesium hydroxide, D. Omeprazole, E. Promethazine. So the 70-year-old man here is experiencing symptoms consistent with gastroesophageal reflux disease, including heartburn that worsens when bending forward and the need to sleep on a wedge-shaped pillow to reduce symptoms. So the most effective agent to alleviate his symptoms is omeprazole. Why? Because omeprazole is a proton pump inhibitor that irreversibly inhibits the hydrogen potassium ATPase pump in gastric parietal cells, thereby significantly reducing stomach acid production. Proton pump inhibitors are the most effective treatment for gastroesophageal reflux disease, especially in chronic or severe cases. Bisacodyl, on the contrary, is a stimulant, laxative, used for constipation with no effect on acid reflux. Cimetidine is an histamine H2 receptor antagonist that reduces acid secretion but is less effective than proton pump inhibitors like omeprazole. Magnesium hydroxide, the C option here is not right because it is an antacid that neutralizes stomach acid temporarily but does not prevent acid production. Promethazine, the E option, is an histamine H1 antagonist used for nausea and motion sickness, but with no effect on gastric acid secretion. So omeprazole, as we have seen, is the treatment of choice for this patient with gastroesophageal reflux disease. Question 4. 3 months after needle stick exposure to blood from a patient with hepatitis B, the nurse is tested for infection with the virus. The lab results reveal hepatitis B surface antigen absent, antibody HBs antibody absent, antibody HBC IgM present, antibody HBC IgG absent, hepatitis B envelope antigen absent. Based on this result, which of the following statements most accurately describes the nurse hepatitis B status? A. She was effectively vaccinated against hepatitis B before the needle stick exposure occurred. B. She developed an inappropriate antibody response as a result of an immunocompromised state. C. She is a carrier of hepatitis B. D. She is actively infected with hepatitis B And E, she was not infected with hepatitis B. So the analysis here depends on the serological markers to know the status of hepatitis B for this nurse. So we would like to remind ourselves that the absence of hepatitis B surface antigen indicates that there is no active infection. The absence of hepatitis anti-hepatitis HBs surface antigen, no surface antibodies. The absence of antibody HBs indicate that there is no immunity, neither from vaccination nor from past infection. The presence of IgM antibody HBC indicates recent acute infection, because here they have told us that anti-HBC IgM is present. The absence of IgG anti-HBC indicates that there is no long-term immune response, or that the infection is very recent. The absence of HBe antigen suggests low viral replication or early clearance phase. So we need to recall that the presence of IgM antibody HBC without antigen HBs is unusual, but can indicate an acute infection with rapid viral clearance. This suggests that the nurse was recently infected with hepatitis B and her body might already be eliminating the virus. So the best answer here is D. She is actively infected with hepatitis B. Best answer is option D. On question 5, a patient admitted to the emergency room with chest pain is diagnosed with myocardial infarction. On discharge, the patient is prescribed aspirin but develops an allergic hypersensitivity reaction. Clopidogrel is then prescribed instead as a maintenance anticoagulant. Which of the following is the mechanism of action of this drug? Here they're asking us about the mechanism of action of clopidogrel. So we'll say that clopidogrel is an antiplatelet antigen, is an antiplatelet agent or an antiplatelet drug belonging to the class of ADP-P2Y12 receptor inhibitors. So it acts by inhibition of the ADP-P2Y12 receptors. The active metabolite of clopidogrel irreversibly binds to the platelet P2Y12 receptors, thus preventing ADP from binding to these receptors, thereby inhibiting the activation of glycoprotein 2B3A, which is necessary for platelet aggregation. By blocking platelet activation, clopidogrel therefore reduces thrombus formation and limits the risk of thromboembolic events like myocardial infarction, stroke, coronary stent thrombosis. So the best answer here is the C option. It blocks the adhesion. So it blocks the adhesion of ADP at its receptors on platelet because it fits to the P2Y12 receptors. So the best answer there is C. And we'll just we'll just tell ourselves that discipline and consistency constitute the sole bridge between set goals and their achievement. So whenever we set a goal, we must apply discipline, we must be consistent in our daily works in order to achieve our set goals. Thank you.